The goal of this is that people can at least get something started on their own and really have a better way of going. As you guys are getting ready, after you go through everything and you're getting ready to write letters, whatever, it's really, really helpful if you watch both of those two YouTube videos. It explains what IDPH says compassionate care is. It explains what IDPH says essential care is. So everybody knows, CMS does not acknowledge an essential caregiver. Because of that, I will tell you every time to always ask for compassionate care first, because it has more weight behind it. Call your ombudsman, email your ombudsman. Does that everybody know what an ombudsman is? Let's start there. So an ombudsman is a neutral mediator, essentially, that works between the resident and the facility, two residents if they're in a shared room and they have problems. Ombudsman, first of all, is obligated to represent the resident before they are anybody else. So we can go to our ombudsman and we can call them and ask for help or email them. They still have to go by what the resident says to them if the resident can communicate with them. It's really necessary because somebody has to be a neutral party for them, because not every resident has a family member that's truly looking out for their best interest, is the best way to put that.
In lieu of the resident, would it be the guardian then?
Yes,
Okay,
it would be the guardian, it would be the medical power of attorney.
okay,
But like in your case where you're your daughter's guardian, yes. Step one is always going to be contact your ombudsman. And the ombudsmen are listed by counties. On the list will either give you your regional ombudsman or just a regular ombudsman. What I've recently learned is there's actually over 200 ombudsmen in Illinois, but these are the contacts. These are where you start. The state ombudsman and her 3 deputies are on there, especially those of you up in the Chicago area, Cooks County, all further north you go. If you reach out to your ombudsman and you have not heard back in 3 to 4 business days, and I stress business days, reach out above them, whether it is the deputy, and you'll see, each deputy covers a part of the state, or the state ombudsman. They do try really hard, but there's the people in Cooks County are drowning anywhere up there because there's so much. And just telling them why you're contacting them, who you are, if you're their family or you're their friend, what city is the facility in, and the name of the facility, and that you're going to be asking for compassionate or essential care.
So when you email the ombudsman, you also copy the facility in, or you don't?
So the first email to the ombudsman is just you introducing them and a real short, concise, hey, this is what I'm going to be doing, and I'm going to be including you on all of my emails. So that way, when they start getting these emails, they know why. The next step is gathering your contact. The more people that you can involve in that first email when you make your request, the better. If you can get all the way to the president of the company, include them. It's just not always easy. The one thing is, if a company uses a formatted email address, and there's my examples. If you know that both your nurse and your executive director, that the end of their email is exactly the same, and you know of anybody above them, first and last name, the odds are it stays the same. But if you get into a facility that it has the first and last name, then nursing care, and then a facility name or a building name behind it, that's where it gets difficult to getting people at corporate, because it's finding out what that last piece is. And you might have to ask, and just don't let them tell you no. Tell them, no, I need to know, everybody has a supervisor. Who is yours, and how do I get hold of them? They are counting on the fact that they're going to intimidate you, that you're going to worry that they're going to retaliate, And they're gonna say enough things to make you back down because I don't want them to hurt my mom. I'm worried that they're gonna throw my son out. It's against the law. And facilities that are threatening people need to be turned in.
I kind of verbalized it, and they kind of just kept blowing me off, and nothing was ever really done. So then I took your advice and I wrote an email, and on the subject line I said seeking formal request for compassionate care. And that's what I think when you put in your subject line, say formal request for compassionate care. I got compassionate care first because my dad's facility's been in outbreak. They're no longer,
Right.
but when I first started going in the first part of December, they were in an outbreak situation. So
Okay.
I was able to get in with the compassionate care.
The letter is really, really important. I will strongly suggest if there's anything positive you can put in there in any way, shape, or form, start with positive, end with positive. Unless you absolutely have no choice, do not throw somebody under a bus. We have to remember, no matter how hard this has been on us and on our loved one, the facilities have been through hell and back this year. Whether we want to really acknowledge it or not, the staff, all of them, they're suffering too, especially in facilities that have had a lot of COVID deaths. Until you have to play dirty, don't. And it truly makes a difference of not doing it, So even if I appreciate everything you guys have done. I understand your hands have been tied, but we need to find a way around that. You want to convince them that we're all on the same level playing field. And it really does make a difference in the end.
Do you suggest in the first letter that we send to the facility, should we say we want to update their care plan or whatever you want to say, and we want to include essential caregiving or caregiving? Can we say either one, or should we say either one, or should we say we want this?
No, you want compassionate care.
Yeah.
Because if you have compassionate care, they can't lock you out indefinitely. Okay. Now let's say they go back into outbreak status, and after they've started letting compassionate caregivers in, it's the first time they go back into outbreak status since they've started it. They could say, you know what, we need 5 or 6 days to be able to rearrange and figure out where we're going to let these visits happen. If you're an essential caregiver, they are allowed to let you in, but they don't have to let you in. So, which is why IDPH tells them, if it will benefit the resident, switch it to compassionate care, but they're not going to just do that.
Yeah, and what Carrie's saying too, with compassionate care, you can be there whether there's COVID in the facility or not.
Yeah.
Starting with the things that that have changed about your loved one. If you're not sure, but you think there might be a significant weight loss, call and ask before you write your email. That's why you're going to tell them what you're planning on doing with him, okay? Or with whoever it is. Everything you're going to do when you request this is going to be cause and effect. Or that, ooh, mom has hearing aids, but I haven't seen her in them in 6 months. Then you use the line of, I can't communicate with her through a window or by phone because she's not wearing her hearing aids. I don't know if they've been lost, or is she not wearing them because somebody doesn't know how to assist her in putting them in right. I can come in, I can figure out if they're there or not. I can then, if they are there, make sure they're working and teach people how to put them in or properly. Cause and effect with anything you can come up with. The more reasons you come up with of what the resident needs and what you can do to help it, the better. And even little things of, if you've noticed something that maybe isn't as obvious to the average person, you've noticed when somebody was walking mom or dad through, and you saw them through the window, and you notice all of a sudden they're just dragging their left side a little more than normal, or they appear, or you've been told they're falling more. You know, obviously hopefully you can go in and walk with them and help them build strength, or you can be there when somebody else is walking with them to help get your loved one to be more willing to work with that person. Nowhere in there can they require you to make it physical contact or physical assist. They cannot tell you, well, if you're coming in, you're doing all the toileting, all the feeding, and all the bathing while you're there. They can't do that. Everything you're going to do when you request this is going to be cause and effect. My son, very much so, we noticed I had him home in July, and then we had him home again in September for 4 days each time. We noticed a huge cognitive difference with him in those 2 months. I mean, his speech was worse. He was just mentally slowing down. So our cause and effect was, because he's not around other people, he's not socializing enough, he's not engaging his own brain. And for somebody that has a severe seizure disorder and has had brain surgery and everything else, if you don't use it all the time, you're going to lose it. The cause was, you know, here we were cognitively. The effect was, by me coming in while he was eating and walking and stuff, I could also engage him in conversation.
Will anything from the doctor say she needs contact for her mental health help?
It sure can't hurt. So yes, the doctor can help with that.
You can ask you know, to update the care plan, and they should put the essential caregiver and the compassionate caregiver within their care plan.
And IDPH brought this up way more than anyone else. Is part of the other thing you're doing right now is you're requesting for a new care plan. And you're being added to it. And what you're going to do with them is being added to it. The other thing that you'll see it in the sample letters is that you want nights, weekends, and holiday access. Even if it's that you only want 1 day on a weekend, you know, they are supposed to be making some reasonable accommodations. And that's exactly it. Email everyone and make sure it is CC so it's visible. Always, always, always include the ombudsman and make sure the facility can see that you've included the ombudsman. You will notice everywhere in here I constantly say email. And for multiple reasons. And if you have to resort number 2 and you can't email them, if you can do it by a text. Okay, phone and in person is your last option. It is also one of the reasons for the email is more of you want your documentation. One of the things we're finding with facilities is you send them an email and they call you because they don't want to give it to you in documentation. If a facility does that, the minute you get off the phone, email them back with, hey, per our conversation, I want to clarify that you just said this, 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 and this. The reason they're calling is because they don't want documentation. Emails, texts, but either one, so you have the documentation. So again, and even those things, document, especially if someone says something to you on one of those lines. No, I'm not telling you who my supervisor is. I'm not telling you how to get hold of them. That's fine. Write it down that that's what they said and when they said it. Because then when you go to eventually we'll get to the supervisor, then you're gonna be like, you know, she's told me this 5 times that I couldn't speak to you. And we had these conversations on June 1st, June 8th, and give it to them. They forget in the end, they truly are working for our loved ones.
So when you were talking about putting everything in an email and, you know, for documentation purposes, and when the facility calls you back and gives you a verbal response, do you then like recap that conversation in an email, follow-up email back to them?
Every time.
Okay.
Every time.
Yeah.
Because it will come down to he said, she said.
Right.
The other thing is you need to put real clear cut timelines when you contact them. that, I would like to be in there by the end of next week. I would hope to hear back from you within, and you got to be reasonable, but don't
Mhm.
Or something.
don't give them an open door either. In May, Governor Pritzker and Dr. Zike issued a statewide memo. So, and this is, that document that Fran has up now is what part of IDPH is, what clarifies is being in a healthcare setting, what the support person is needed for, all the rest. Stating that anybody with a cognitive, developmental, or intellectual disability is allowed a support person with them in a doctor's office, in a hospital. It does not matter. They have to allow them to go in. Now, I can tell you, if they're in a COVID unit, most of them don't care. They're not letting you in. I only know of one person that's gotten into a COVID unit. But anywhere else going into the hospital, they need to allow you to go in with them. Or a doctor's office, a lot of times you get there and they're like, well, we're only letting one person in. No, he can't answer the questions for you. He doesn't see it, and print this document out that's in here and keep it with you. Ask them to call a house supervisor, whatever you've got to do to make sure you can stay with them. And especially in any hospital and in any emergency room, make them call a house supervisor.
A lot of times they're going to say, with people that are older, well, they can make decisions, but if they're in the ER, one of the biggest things within that support document, it says that they're cognitively impaired. And if you are in the ER, if your blood sugar is all over the place, if your blood pressure is down, you're dehydrated, you are cognitively impaired. And you can push that point right there. It doesn't have to be a developmental delay.
If they're in the hospital as an inpatient, most hospitals right now, because of COVID, have if we're allowing a visitor in, you're only allowed one person every 24 hours because they don't want people swapping in and out because of germs. They can hold you to that one, but usually if you get the right person, they won't. But if your loved one needs somebody sitting 24/7 with them right now in a hospital, be prepared to negotiate and ask and beg and plead but the same thing there. I mean, obviously you're going to walk in with a mask, and any PPP after that they want on you, they should give it to you. But like I said, the COVID unit is the one place that I have found nobody's getting around it. So where the comment down here of, that somebody has compassionate care because they're in an end of life situation, compassionate care under IDPH and CMS guidelines does not mean end of life. It's all documented in these things we're going to give you, especially the YouTube videos, the one from November 6th. IDPH's definition in the end, when you listen to their words, is if it is going to benefit the resident, give them compassionate care. You're going to be hard pressed to find a single person it's not going to benefit.
I think part of her question too was that they're telling her, the facility is telling her that her mother has gotten stabilized, and so they're going to end the compassionate care. That's what her question was. How does she go around that?
We need to make a list of things your mom or dad still need help with, and then what you're going to do to facilitate that. Even if she's stabilized, the examples, there's a ton. So like this, somebody who just moved into the facility, obviously this is going to be a huge shock. They should automatically be given compassionate care because they're going to need it for their mental well-being. If a resident has lost a family member or a friend in the facility, or someone because of COVID, they're going to be mourning, they need support. Things like this, where it talks about any resident that was talking and expressing themselves, but now they're not. Or all they're doing is crying, failure to thrive, losing weight. They were able to feed themselves and now they're not. Any one of those things qualify for compassionate care.
That's my question.
Okay.
They're saying she is stabilized, and hospice is saying, no, an end-stage dementia patient is in cognitive decline. They are not stable.
Okay,
I just don't want our compassionate to care status, thus that it is, to end. So, yeah, I was
Okay.
just wondering if anybody else had this situation where it was taken away from them and what they did.
so then are they gonna give you essential care, or are they just gonna throw you out? Because they can't cut you
They're
off.
throwing me out.
Like just asked up here to me, well, her facility is gonna say they provide all the assistance her daughter needs with ADLs, which is activities of daily living. Dressing, bathing, feeding, grooming, all that, that's all considered an ADL. Just because they provide it doesn't mean they are the only ones that can. That's first. And she is going to benefit greatly by you doing it over them.
Yes.
And that's what you have to show. Cause and effect. It's taking everything IDPH has given us in writing and turning it into how do we make it sound right? Which is why I'm a
Okay.
huge believer in copy and paste. IDPH put this out on this day in quotation marks, and then here's my paragraphs following that. And this is the best part of it here is it in their own words. IDPH clearly states that if a resident can benefit from it, you really need to offer that compassionate care visitation. Again, there is no resident that wouldn't benefit from it.
In compassionate care, we can touch them, right?
Yeah,
don't
as
have
long
to-
as you ask
And
for it the
with-
right way.